Right here, you can kind of wiggle it around and see where it moves and where it is. And then the bursa is just going to be kind of right underneath it to prevent that friction between the two bones. The patellar tendon comes, right there, comes just distally from that patella, and it's just this tendon right here. It's part of the quads that come down and connect to the tibia. So it's just this tendon right here, patellar tendon. Patellar tendon bursa is just going to be underneath that tendon. Patellar fat pads, if you come down and find kind of where your fingers stop, right, that's kind of where your fat pad is going to be, just distally to that patella. Femoral trochlea, if you force them into a little bit more flexion, you can feel, so there's, your femur is kind of shaped like this. There's kind of an outcropping. So it's just that middle part where there's not really a whole much, that's where your ligaments attach. So if you force them into that flexion, you can feel where those two condyles separate, and that trochlea is right where that patellar, where the patella would be sitting if he was in extension. So it's just right in the middle, okay? Tibial tuberosity, it's just on that tibial shaft. It's just the tuberosity that pops out a lot more proximal, almost to the joint line. Quadriceps tendon is the proximal portion of where that patellar tendon comes from. So quads come together, meet up right here to make the quadriceps tendon, come down to make the patellar tendon. So quadriceps tendon are just on that proximal side of the patella. Vastus medialis, go and squeeze your quads. So you can see that muscle popping up right here. That's your vastus medialis. Rectus femoris, is the big muscle that's straight on top. So, if you come up just mid-shaft of that femur, that's where that rectus femoris is. Vastus lateralis, sorry, squeeze again, is that lateral muscle just right here on the lateral side. Okay, sartorius can be kind of a difficult one to see, but you just need to know that it attaches medially and comes and crosses that femur and attaches clear up at the hip. So go ahead and squeeze. We can see if we can see it, but just know that it attaches from here and it crosses up to there. Pes anserine tendon. So there's three muscles that attach onto the pes anserine, which is going to be just medial to that tibial tuberosity. If you come down kind of onto the tibia and plop up, you can kind of feel where that tuberosity is, and that's where those tendons attach. So that's kind of where the pes anserine tendon is. Medial meniscus and joint line, so that's where your femur and tibia are going to attach. So I like to come down, drop onto the tibial plateau, and right from there you can go medially and feel the difference between your femur and your tibia, and feel that joint space right there. And that's where your medial meniscus is going to be, just right along that joint line. Medial tibial plateau, right? That's where I like to drop down and where my fingers get caught on that tibia. That's that medial plateau. Your medial collateral ligament is going to be attaching your femur to your tibia. So, again, if you find that joint line, you can kind of go posteriorly and come anteriorly, and you can feel where that tendon is just crossing that joint line. Ligament. Your medial collateral ligament. Medial femoral condyle and epicondyle. So you can force them into flexion, but you can also feel it just when they're in a little bit of extension. Right, so we found the femoral trochlea just on top, and where we drop down onto that tibial plateau, just proximal to that, that's the medial condyle, and then lateral to that, can't really feel it, but there's a little bit of a smaller bump. and that's the epicondyle. So condyle's going to be the big bump, and then just inside it is the epicondyle on that medial side. Your gracilis is a medial muscle. This is one that you can really feel. It comes down and attaches to that pes anserine right in here. But that's one of the big ones that you can feel. You want to make sure that you're not hitting the hamstrings. So it's just going to be in between the hamstring and that vastus medialis is where that gracilis is. Semitendinosus tendon. So the tendinosus and membranosus are on the medial side. Semitendinosus, so if you come around and just grab underneath where that hamstring is, the tendinosus one is kind of like the guitar string of the two. It feels like you can just pluck away with it. And then just deep to that, if you slide your finger underneath that tendon, you can feel where that semimembranosus tendon is. And then, let's see, sartorius. Where did you do sartorius? We did. Okay. Lateral side. So we found that medial joint line where the femur connects to the tibia. And I mean, this one also connects to the tibia because the fibula is a lot more distal. So, I mean, come down, feel where that tibial plateau is, and you kind of feel where that joint line is between the femur and the tibia. And you want to make sure, like, to feel these things, you really have to put on pressure. You can't just, like, pet along the knee. You actually have to put in some effort to feel where that is, okay? Fibular head is just distal to that joint line. You can just, I mean, you can grab onto it. You find muscle, go underneath it, and it's this little ball that's sticking out. That's not the tibia. So that's the fibular head right there. Lateral collateral ligament. So you can kind of force them into a little bit of a external rotation and flexion. So if you find that joint line again, and then kind of go from posterior to anterior, you can feel where that lateral collateral ligament is, okay? Popliteus. This one is a little bit easier to see when they're laying prone, but it's right in that popliteal fossa underneath, just behind the knee. And I'll go back and show that when we get there. But biceps femoris. So lateral side, biceps femoris is part of the hamstring, and you can feel that tendon, just right there on that lateral side. You can grip onto it, and you can see it right on that lateral side, but you can feel the tendons really well, just coming across that knee joint. Iliotibial band. It's going to be right here, just along the outside of that knee, outside of that leg. It attaches kind of almost across the hip, but it attaches to some muscles up here, and then comes down and crosses the knee. But it's just that tight band, so if you kind of roll your fingers over those lateral muscles, you can feel kind of a tighter structure. That is the iliotibial band. Gerdy's tubercle is just the opposite of the pes anserine. So it's on the lateral side, and it's kind of a little bone outcropping on that tibia where some muscles attach, just right there on that tubercle. So Gerdy's tubercle, it's not like the tibial plateau, it's just underneath it. Lateral femoral condyle. So again, you can force them into some flexion, and you can feel where those condyles are separated from that trochlea. So just on the lateral side, you can feel that part of the femur right on that lateral side. All right, flip over. Okay, popliteal fossa, just on the other side of the knee. It's just this space right here. It's not a specific structure per se, it's just the location, popliteal fossa. Plantaris. So I mean, you have a couple of muscles that come back here through this popliteal fossa. You're going to feel the heads of the gastroc, and then deep in there, there's another little muscle. The plantaris. Is that the one I'm on? Is on plantaris? I don't remember what I said. Plantaris. Okay. So plantaris is just a really small muscle. I mean, it's probably about that long, and then the rest is just a tendon. So if you can kind of move the heads of those gastrocs out of the way, you can feel just another muscle kind of poking out right there, just a little distal to that popliteal fossa. Biceps femoris, we chatted about this. It's on the lateral side, that lateral hamstring right in here. Ischial tuberosity, it's what you sit on, okay? So it's going to be just kind of right where your pocket is almost. It's just the bone that sticks out kind of right in the middle of that gluteus. And you can kind of, you can wiggle around his femur to kind of get an idea of where his femur attaches, and then it's just a little bit more proximal to where that is. So, if you're to sit down, you can kind of feel where that's going to be, that first bone that pokes out. Okay, lateral head of the gastroc and medial head of the gastroc, we kind of hit this already. Push against my hand. You can see the muscles popping out. So lateral side, lateral head's obviously going to be on the lateral side, and then the medial head's going to be on that medial side. Okay, anterior structures. Flip over. Rolling all over the place. Okay, if we do pubic bone, you're probably just going to feel it on yourself. But right, it's just that if you go down where your abs are, and then it's the first bone that you hit. So that's just your pubic bone. I don't think we're going to have you touch that on us, though. Okay, inguinal ligament. Lay down. And hold your breath so you don't squirm everywhere. Okay. So we're on the hip bone, right? So the inguinal ligament is the barrier between kind of the leg and where your visceral is. So you can kind of feel, if you come through, you can feel the difference between leg and then kind of a little bit more hollow space of where all your viscera is. And that ligament just kind of carries down, connects to the pubic bone, and goes up. So it's just that barrier right there. That's a ligament. Anterior superior iliac spine. So it's the first bump that you're going to feel as you come down his hip bone, right? So that first one that you feel is that anterior superior iliac spine. If you go up even more, you're going to hit that crest where, sorry, I'm going to roll up your shirt just a little bit. So if I was to put my hands on my hips and where I kind of get stuck, that's where your iliac crest is. Follow that crest down. The first bump you feel is that anterior superior iliac spine. And then as you follow it down a little bit more, this one's a little bit deeper, so it's a little bit more difficult to feel. But if you bring your patient into a little bit of hip flexion, you can kind of feel it where it's a little bit deeper and a little bit more distal to that anterior superior one. So anterior inferior is just anterior and inferior to the anterior superior iliac spine. Okay, adductors. Okay, adductors. We talked about gracilis, where it's in between your hamstrings and your vastus medialis, right? You got your gracilis right there. And then your adductor longus, you can feel just a little bit more proximal. Again, you want to be just almost like posterior to your vastus medialis. These ones all kind of blend together, and they're kind of hard to differentiate from each other, I think. But your adductor, adductor magnus is kind of the one that sticks out. if you bring them into a little bit more abduction, it's the muscle that sticks out kind of the most because it has the biggest angle. It attaches a lot more, I don't know, medial than the other muscles do, so it kind of has a big angle as it comes across. So it's the first one that you can feel as you come across that that medial side. That's the adductor magnus. And then adductor brevis is a little bit deeper than that adductor magnus. So it'll be longest, and then you got your magnus, and then brevis is just a little bit more deep. And then gracilis, you can feel just in between the hamstring and that vastus medialis. You're doing great. Okay. Iliac crest, right? When you drop your hands down on your hips, it's that round piece of that iliac that you can feel. It's like a C almost. So iliac crest is just right in there. Tensor fascia lata. So I like to think of it as your pocket muscle. So if I were to put my hands in my pocket, here, put your hands in your pocket. It's that muscle right there, right where his hand is laying. It's just going to be just inferior to that anterior superior iliac spine. It just kind of lies on the side and in front, okay? Okay, gluteus medius. It's just off to the side of that tensor fascia lata. So, I mean, you have your pocket muscle, and then it's your side hip muscle. That's all the glute medius is. It's just right on the side. Your greater trochanter, that is the head of your femur. So it's the first, well, you can feel it just right on the side. So if you find that tensor fascia lata and that gluteus medius, it's that bone that's sticking right out. And if you have a hard time finding it, you can kind of move that femur a little bit to force it into some motion so you can feel it moving in that joint, and that'll help you kind of find where that's at. So that's the greater trochanter. Trochanteric bursa is just going to be right on top of it. So if you find that greater trochanter, you're going to find the bursa. Okay, where are we? Put around. We're on our last thing. We're so close to being done. Just enjoy your time. Okay. The medial sacral crest. So if we come down, we're on the back, we're following the spine, and you can kind of come down. I feel like it's a little bit more comfortable to use the heel of your hand, so you're not as in like as much personal space as you're feeling around. So I mean, you can feel where those spinous processes are, and you come down, and you kind of stay right in the middle of the two gluteus maximus, and that's where your sacrum is. It's just right in between, and that's where your medial sacral crest is. Okay, posterior superior iliac spine. So it's posterior and it's superior on the ilium. So if you find that iliac crest again and then follow it posteriorly, it's going to lead you to, they kind of feel like two marbles on your back, and it's just before you hit that sacrum. So you have your sacrum in the middle, and then you have your posterior superior iliac spine just lateral to that. Okay, gluteus maximus, right? Big muscle in the back. This, I mean, you can touch it. It's just a muscle. Ischial tuberosity and bursa, kind of found this one underneath that gluteus maximus. It's going to be that bone that you feel that's kind of sticking straight out at you. Sciatic nerve comes down. It kind of comes down the middle of your gluteus maximus and then down the center of your femur. So I mean, if you can kind of just feel down his femur, you can kind of follow the track of that sciatic nerve. And I'm not going to do those other ones because we're already on them. Okay. Does anybody have any questions?